You're in the middle of a workout. Something feels off. A pinch in your shoulder, a pull in your lower back, a sudden wave of dizziness. And what do? You push through. Because that's what we've been taught. No pain, no gain. Mind over matter. You're not a quitter. I'm Dr. Maya Carter. I'm 45. I'm a physician who has spent the last decade treating women who pushed through until they couldn't, until that pinch became a tear, until that pull became a herniated disc, until that dizziness was the first warning of something far more serious. Today, I'm giving you 5 red flags, 5 signals your body sends that mean stop immediately. Not modify, not push lighter. Stop, ignore them, and you're not being tough, you're being reckless with the only body you have. Stay with me. This might save your fitness and your future. Let me tell you why we do this. Why smart, capable women ignore clear warning signs. We've been conditioned. Fitness culture worships intensity. The sweatier, the shakier, the more destroyed you feel, the better the workout. We're sold images of 25-year-old athletes and told age is just a number. Age isn't just a number, it's information. It's your hormones shifting, your recovery slowing, your tendons losing elasticity, your bone density changing. These aren't weaknesses, they're realities. And here's what I've learned in my practice. The women who thrive after 40 aren't the ones who push hardest. They're the ones who push smartest, who listen first, then act. These 5 red flags, I've seen every single one lead to surgery, chronic pain, or cardiac events that could have been prevented. Not because the women were careless, because nobody told them what to watch for. I'm telling you now. Red flag 1, sharp, shooting, or radiating pain. There's workout pain, muscle burn, fatigue, the deep ache of effort. That's productive. That's growth. Then there's warning pain, stabbing sensations, pain that travels down your arm or leg, pain that makes you catch your breath and change your movement to compensate. If you feel a sharp pinch in your shoulder during an overhead press and it shoots down your arm, stop. That could be impingement. A rotator cuff on the verge of tear. Pushing through doesn't build strength, it destroys tissue. Lower back pain that radiates down your leg, sciatic nerve involvement, disc vulnerability. One more rep could be the one that herniates. The rule: if you can't take a deep breath and relax into the pain, it's wrong pain. Stop. Assess, modify, or exit. Come back when you know what it is. I have patients who ignored shoulder pinches for months. It loosens up, they said, until it didn't, until they needed surgery and 6 months of rehab. The loosening up? That was your nervous system numbing the area. Not healing. Numbing. Red flag 2, inability to recover your breath within 2 minutes. Exercise elevates heart rate and breathing, obviously, but here's what should happen when you pause. Within 30 seconds, breathing starts slowing. Within 2 minutes, you can speak in full sentences without gasping. Your heart rate feels manageable. If you're still struggling to breathe after 2 minutes of rest, if you're dizzy, nauseated, or your heart is hammering irregularly, that's not fitness, that's distress. In women over 40, this can signal cardiac issues we don't expect. Arrhythmias, reduced cardiac output, blood pressure spikes. The cardiac event that seems sudden is often preceded by exactly these ignored warnings during exertion. The rule: if you can't recover your breath and speak normally within 2 minutes, the workout ends. Not the set, the workout. Call your doctor, get checked, come back when you know your heart can handle what you're asking. I've sent 3 patients for cardiac workups this year based on this red flag alone. 2 needed intervention. 1 had a blockage that would have been catastrophic if she kept pushing through. Your breath is information. Listen. Red flag 3, urinary leakage during movement. You jump, you run, you lift, you laugh with your workout partner, and you feel it, a little leak, a spot in your underwear. You make a joke. That's what happens after kids. Welcome to being over 40. You wear black leggings and keep going. Stop. Leaking during exercise is common. It is not normal. It's a sign of pelvic floor dysfunction that will worsen without intervention, and it's directly connected to spinal stability, hip function, and core integrity. Every time you leak and continue, you're reinforcing a pattern of compensation that strains your lower back, destabilizes your pelvis, and sets you up for incontinence, prolapse, and chronic pain. The rule: if you leak, the high-impact movement stops immediately. Not wear a pad and keep going. Stop. See a pelvic floor physical therapist, learn activation, rebuild from the inside out. I treat women in their 60s who wish they'd addressed this at 45, who gave up running, jumping, even brisk walking because the leakage became constant, who needed surgery that could have been avoided. The joke isn't funny, it's a warning. Listen now. Red flag 4, joint pain that persists 24 hours after exercise. Muscle soreness? Normal. Delayed onset muscle soreness peaks at 24 to 48 hours, then fades. That's adaptation, that's growth. Joint pain, knee, hip, shoulder, wrist, that's still there the next day? That's inflammation. That's your joint lining protesting. That's cartilage being worn unevenly. That's the early grind of osteoarthritis. If your knees ache for a day after squats, your form is wrong, your depth is wrong, or your joints aren't ready for the load. Continuing doesn't make you stronger, it makes you a candidate for replacement surgery in your 60s. The rule: joint pain beyond mild stiffness 24 hours post-workout means that exercise is wrong for you right now. Modify, reduce load, change angle, or substitute entirely. Walking instead of running, swimming instead of high-impact classes, wall sits instead of loaded squats. You're not quitting, you're being strategic. I see women who worked through knee pain for years, who now have bone-on-bone changes and limited options, who would give anything to go back and choose differently at 45. You can choose differently now. Red flag 5, persistent exhaustion that doesn't improve with rest. You sleep 8 hours, you wake tired, you drag through workouts that used to energize you. Recovery takes days instead of hours. You're losing strength instead of gaining it. Your mood is flat, your motivation is gone. And you tell yourself you're overtrained, you need a rest week. You push through anyway because stopping feels like failure. In women over 40, this pattern often signals hormonal collapse. Adrenal fatigue, though that's not a formal diagnosis, the experience is real. Thyroid dysfunction, perimenopause hitting like a wall, iron deficiency, depression. Pushing through exhaustion doesn't build grit. It breaks metabolism, it suppresses immune function, it can trigger autoimmune flares, cardiac strain, and mental health crises. The rule: if proper rest, 2 weeks of reduced activity, quality sleep, nutrition, doesn't restore your energy, see your doctor. Full workup, hormone panel, thyroid, iron, vitamin D, mental health screening. I have treated women who pushed through this red flag into full adrenal crisis, who developed autoimmune conditions, who burned out so completely they couldn't exercise for a year. The rest week you refuse now could become the rest year you can't escape. 5 red flags, 5 times to stop, listen, and choose differently. Not because you're weak, because you're wise. Because you have decades of movement ahead and you want them to be strong, capable, joyful years. The women who ignore these signals, they don't win, they break. They sit out the second half of life watching from the sidelines. The women who listen, they modify, they heal, they return stronger, they run 5 kilometers at 55, they hike mountains at 60, they dance at their grandchildren's weddings without fear. Comment below, which red flag have you been ignoring? Let's stop the shame and start the conversation. Your honesty gives the next woman permission to listen to her own body. Subscribe to Prime&Power. Dr. Maya Carter here every week with real medicine for real women 40 plus.